Ralph De La Torre. He's chairman and CEO of Steward healthcare system. Ralph traded in his surgical blues for pinstripes back in 2008, taking over a Boston chain of nonprofit hospitals that he brought back to profitability and later sold to private equity firm Cerberus. Ralph, great to have you here on Taking Stock. You and I have talked at length about healthcare reform and what's before the Supreme Court justices. If President Obama's healthcare law is struck down, can other parts still stand in your view?
Well, I'm not a constitutional lawyer, but, you know, I think, yes, I think the justices gave an indication that that's what they would do. I think the real question for investors is what parts get struck down, what parts stand, and how kind of the market changes to fill those gaps.
If you were a betting man, and I understand, you know, you're watching this closely, it's hard to say how it ultimately will play out because there's so many moving parts and so many people certainly weighing in, but if you were a betting man, what do you what parts will ultimately stand? Can you get any feel of that at this point?
Well, I think that all of it's going to stand. I actually don't think they're going to repeal the individual mandate. So I may be probably the only person in America that believes that outside of the White House. But, you know, I think it will. I think that if it does get struck down, most of the other parts will stand. And that's what begins really a dilemma for a lot of the different components of healthcare. For the hospital business, for example, the hospital industry gave back a lot of concessions in order to make the individual mandate and the expansion of universal care possible. And if you take away the diminution of bad debt and you're left still with the changes that they gave, they could see some difficulties for certain segments of the hospital industry.
What about for you specifically, your hospitals and your facilities? Will they be impacted?
We won't be. We're in Massachusetts. So in Massachusetts, we've already have all this in place and have had all this in place. So in Massachusetts, things won't fundamentally change. Our industry, I think the only way that it would impact Steward is just our expansion plans. I think it might make them a little bit more difficult as the rest of the United States or pockets in the United States kind of grapple with how to deal with all this change.
You know, as I pointed out, you and I have talked about healthcare reform. You do think, I mean, we need to have some significant changes in place because in terms of the cost, it's just, we know it's all getting out of control.
Mm-hmm. So absolutely, you know, it all starts with the basic premise, which is, do we believe that people deserve health care? Yes or no? Once you get to that fundamental right, if you believe in the fundamental right, then it becomes an exercise in public finance. I think the reason that the industry and a lot of academics have struggled with it is because they've dealt with it from the point of view of public health policy, and it's not. Healthcare reform, once you make the first decision that everybody deserves healthcare, becomes an exercise in public finance. You need to treat it as a business. You need to have a business plan. You need to have, you know, really a modus operandi of how you're going to enact it.
But that all sounds good, Ralph. But, you know, bring politics into this, and it becomes much, much more complicated. You believe it's all going to come through, but, you know, depending on what happens in November, couldn't that complicate things?
Oh, absolutely. Well, you know, I think it's going to come through the Supreme Court, but I think that the battles in healthcare reform are still far ahead of us. There's a lot of the implementation that needs to come to place, and there's a lot of rules and policies that need to be written as a part of healthcare reform that still haven't been. And then I still fundamentally think we're going to have to figure out how to deal with the cost issue. We really haven't addressed it. I think that, you know, the way that it was scored originally, and it dramatically underestimates the cost. But in some ways, we as a society have to come to grips with how much health care we need, how much health care we consume, and how do we go about paying for it. Those are going to be tough decisions that we all have to face together.
Those are tough decisions. Sounds like that ultimately it's going to be very different from what we've all come to expect, certainly today.
Well, absolutely. So I think healthcare needs to fundamentally change. And if you look into the future and you look at Massachusetts and you assume that whatever healthcare reforms comes out of the federal, out at the federal level or at the individual states, if you start with the premise that everybody gets healthcare,
right, and
you try to make it work, you automatically fall into healthcare needs to be much more integrated than it's ever been. Right. You know, physicians, hospitals, post-acute. So there needs to be a movement towards integration.
We got to run. Ralph, thank you so much.
Okay.
Appreciate you finding time this afternoon. Ralph De La Torre, everyone.